Hello, my name is Miguel Acosta and welcome to my presentation. I'll be discussing drug testing at the workplace today and what exactly means to be drug tested and what substances are looking for and what type of jobs are going to be looked at for drug testing or substance abuse. So here, coming up next, my next slide, I'm going to be talking about my goal, which is examining the nature of extent association between workplace drug testing and worker drug use testing and how do they affect each other. To start off, we have to look at companies, laws, and their opinion about substance use and what they do about it. To start off, there's many companies, facilities, and government entities that have a huge amount of education towards substance abuse at the workplace, and every single type of substance abuse at the workplace meant for the worker to work less efficiently and have less working values or work ethics. However, some of these jobs have to be very, very carefully looked at for whose candidates are given these jobs. Some of these jobs consist of carrying 16 or more passengers, including the driver, on public roads, and they have to make sure that some of these people are not abusing any type of substance for the safety of them, the people that are helping out and transporting, and the overall public. Also, a lot of these drivers have to transport hazardous materials, and it requires a lot of education and careful training to transport them safely from state to state or across countries. And drivers as well who are going to be transporting 26,000 pounds or more have to be carefully looked at because the weight has to be very carefully rationed to how they turn, to the routes they're taking, all that good stuff. And a lot of these people, they have to get a license that permits them to do all this, which is called a CDL, or a commercial driver's license. This enables the employer to go through extensive training and be taught different rules and policies about how is the best ways to execute their job. Okay, so what substances are they testing for? So DOT Regulations, which is a government-run facility, has a large array of drugs that they are looking at. However, some of the more common ones that most employers do test for is marijuana, cocaine, opiates, meth, and cyclodine. Each one of these is considered to be a mind. They alternate your mind. They change it, and you could hallucinate. You could experience different time lapses. Therefore, you cannot use this and be safe at work. Employers are also required to participate in alcohol and random drug testing, which includes but is not limited to urine and breath screens. Therefore, that means that if many of your employers are seeing that you're showing up under the influence of something, you are going to be tested for that. However, you could be tested for other things as well, and you cannot deny it, because if you deny it, you will be automatically fired, because that's part of the contract that you signed in at the beginning of your job. So what effects does drug testing have in the workplace? We seem to discuss how it improves, but what exactly do the results say? And I wasn't able to get a lot of research for the other ones because there were so many amount of people who would actually show up under those conditions. However, a very huge drug or substance right now that is being tested for, and it's in a huge gray area, is marijuana. So a lot of research has gone extensively into it because it's so common, and it says that individuals whose employers perform drug testing are significantly less likely to report past month marijuana usage. As well, severe penalties reduces the likelihood of the workers using marijuana at work or before work hours. My research said that, or stated that employees who weren't under the condition of marijuana had significantly more rapid reactions to work fluctuations, had a more focus, uh, more focused and aimed uh, skills, and they were able to perform much better than those who were not under the influence. Public records is also a huge thing that has to be discussed, because if you are caught at work under the influence, what happens to those records? Is your other employee gonna see it? Who's gonna be reading it? Who has power to have these documents? And records of the alcohol and substance use prevention program are maintained as confidential files by the Office of Employee Health with restricted access. Therefore, not anyone can access them. However, if you are under the influence or under any type of substance mentioned above by me, you will have a negative, you will be affected negatively by your employer. And I will be talking a little bit more about what exactly that means and what your employers can do. But all records of verified positive test results are forwarded to the Office of Human Resources and are maintained as confidential files with only authorization by individuals who have a need to know having to access them. This could be a medical reviewer officer if you're in probation. This could also be the healthcare professionals from whose employee is receiving counseling or treatment, if that is something that you would like to do and you like to be clean. To any type of supervisor or management official with the university having authority to take action against such employee, or if of course a response to a federal, state, or local court order demanding these records. These are very vital for future employment, or it could be very important if any type of legal interaction having to do with your efficiency at work. So what exactly determines if someone's unsafe at work under these substances? So individuals who have responsibility for determining whether reasonable suspicion exists to request tests for alcohol and or controlled substance are required to receive training and on the physical, behavioral, speech, and performance indicators of probable use of controlled substances and alcohol. Therefore, this means that the people who refer or are looking for those employers who are not performing very well are also looking at other factors like substances or alcohol abuse. They don't want to, or they're not just targeting you because of this. However, they do want to have a well-ran, efficient company, and having loose ends of people who are under the substances creates an unsafe working environment, also unmoral, and you cannot have that in a workplace because you're not being efficient, and you could very easily be have a lawsuit against you, which you don't really want. Another very interesting aspect of drug testing at the workplace is prescription drugs, because oftentimes certain prescription drugs that you could be taking, like Vicodin, Oxycontin, hydrocodone, they could all come up as opiates abuse on drug tests, as well as other drugs that you probably want to be make sure you're clear for. And if you have a doctor's note or anything like that that validates the use of that substance, ought to be brought to a manager or to the company for them to be aware of your situation and understand that it is medically associated, and you're not just using it recreationally. Recreationally means that you're doing it for fun and other usage other than its medical purpose to heal and target a certain part of your body. So ethics and laws behind drugs. Of course, the establishment of drug testing at the workplace has been is the collection and testing of bodily fluids administered in a manner equivalent that requires by the mandatory guidelines for federal workplace drug testing program, which is the HHS, and this is a regulation 53 federal, regulated in 11979, and it's an amendment, which it is